Good evening, ladies and gentlemen. My name is Hillary Hayhurst, and I'm a student nurse at Beckley's University of Charleston. Today I'll be discussing muscular dystrophy. When you leave here today, my hope is that you are educated with what muscular dystrophy is, who can get the disease, the most common types of muscular dystrophy, the clinical manifestations and complications that muscular dystrophy brings, how muscular dystrophy is diagnosed, and the treatment. According to the Cleveland Clinic, muscular dystrophy is a rare condition that refers to a group of more than 30 inherited diseases that cause muscle weakness. This particular disease affects the skeletal muscles. Over time, the muscles shrink and become frail, affecting the ability to walk or brush your hair, to name a couple. Muscular dystrophy can occur during all ages of life. Unfortunately, there is no cure for this condition, only management of symptoms and slowing of its progression. Muscular dystrophy normally runs in families. Cleveland Clinic states that a child who has a parent with muscular dystrophy may inherit a mutated gene that causes muscular dystrophy. Cleveland Clinic also states that some people have the mutated gene but don't have muscular dystrophy. These people are deemed carriers and have the potential to pass down the mutated gene to their offspring, causing muscular dystrophy in their child. Although there are 30 types of muscular dystrophy, I will only be discussing the two most common types, which include Duchenne type and Becker. Per the Muscular Dystrophy Association, it wasn't until the mid-1980s that researchers identified a gene on the X chromosome that, when mutated, causes Duchenne, Becker, and an intermediate form of muscular dystrophies. 1987 was when the protein associated with Duchenne muscular dystrophy was identified and dubbed dystrophin. According to the Muscular Dystrophy Association, DMD occurs because the mutated DMD gene fails to produce virtually any functional dystrophin. However, individuals with BMD genetic mutations take dystrophin that is partially functional, which protects their muscles from degenerating as badly or as quickly as DMD. When there is an absence of dystrophin, harmful effects arise. Fibrous tissue begins to form within the muscle, which then creates inflammation within the body. DMD is the most common type of muscular dystrophy, and approximately 6 out of 100,000 children in North America and Europe are affected, according to Cleveland Clinic. DMD usually affects boys from the ages of 2 to 5, but girls can get it as well. DMD can affect the heart and lungs as the disease progresses. Cleveland Clinic states that Becker muscular dystrophy, BMD, is the second most common muscular dystrophy, with approximately 18,000 to 30,000 American males from ages 5 to 60 can develop. BMD is more likely diagnosed in males than females and typically affects the hip, thighs, shoulders, and eventually the heart. This type of muscular dystrophy is a lot like Duchenne type, but it progresses much slower. Clinical manifestations with muscular dystrophy vary with each form and the age that the individual is affected. Enlarged calf muscles, difficulty walking or running, abnormal gait, difficulty swallowing, heart complications such as arrhythmias and cardiomyopathy, learning disabilities, joint difficulties, muscle pain, scoliosis, and breathing issues are some of the generalized symptoms. According to Mayo Clinic, the main sign of muscular dystrophy is progressive muscle weakness. There are a few things to diagnose an individual with muscular dystrophy. First, the doctor will take a patient and family history, followed by a physical exam. The physician may observe pseudohypertrophy, which is the appearance of enlarged calf muscles. They may see a lumbar spine deviation, abnormal gait, and diminished muscle reflexes. The physician will order labs of the individual's CK level. CK is the short term for creatine kinase, which is an enzyme that leaks out of damaged muscles. Per the Muscular Dystrophy Association, when elevated CK levels are found in a blood sample, it usually means muscle is being disintegrated by some abnormal process, such as muscular dystrophy or inflammation. High levels of CK may be found before the onset of symptoms. Electromyography, or an EMG, may be ordered, which just measures the electrical activity of the muscle and nerves. Another diagnostic tool in diagnosing muscular dystrophy is genetic testing. Genetic testing will analyze the DNA of cells to see if there is a mutation of the dystrophin gene. And if there is, genetic testing can tell us exactly where it occurs. Genetic testing is usually encouraged if the patient has physical symptoms of muscular dystrophy and has an elevated CK level. If the initial genetic analysis is negative, small and micro deletion or duplication genetic mutation testing will be analyzed next. According to Muscular Dystrophy Association, dystrophin detection by Western blot technique or staining with selective antibodies is carried out in the tissue derived from a muscle biopsy. The Western blot is used to predict the severity of the disease, as the quantity of dystrophin present in the analysis is related to the clinical presentation. Unfortunately, as the condition progresses, there are numerous complications that all types of muscular dystrophy cause. Per Mayo Clinic, some of the issues consist of difficulty walking, which will eventually lead to the individual needing to use a wheelchair. Individuals will have difficulty using their arms, shortening of muscles or tendons around the joint, which is also known as contractures, further limiting their mobility. Patients may develop issues to the point that a ventilator may be indicated. Scoliosis is another complication that individuals with muscular dystrophy develop. Heart issues such as arrhythmias and heart failure can occur. Difficulty swallowing may arise, putting the patient at risk for aspiration pneumonia. A feeding tube may be necessary if this complication occurs. Although there isn't a cure for muscular dystrophy, there is treatment of symptoms and slowing the progression of the condition that is promoted by the NLN's definition of human flourishing. People who suffer from muscular dystrophy will have the interdisciplinary team approach to care. Because muscular dystrophy can affect multiple body systems, multiple specialists will be assessing the patient for optimal function and quality of life. Patients may benefit from customized braces to support the ankle, knee, and foot joints and from straining the Achilles tendon. Participating with physical therapy and occupational therapy will also prolong a patient's ability to walk without assistance and prevent contractures by utilizing range of motion exercises. Other exercises such as swimming is a good way to keep muscles toned without causing excess stress. Gradually over time, a patient will need a wheelchair. Patients with DMD or BMD are encouraged to participate with cardiology and receive EKGs every other year until the age of 10, and then every other year after that. These patients are also encouraged to have an MRI of the chest every 5 years. ACE inhibitors, ARBs, and beta blockers can slow the heart muscle deterioration in those with DMD. As soon as abnormalities are noted on an EKG, these medications are started. Because patients with muscular dystrophy are at risk for malnutrition, it is encouraged that individuals pay attention to consuming calcium, vitamin D, and fiber to prevent constipation on an immobile patient. According to the Muscular Dystrophy Association, corticosteroids are the mainstay of pharmacologic treatment, as they have been found to be effective in slowing the course of DMD. Children should be started on these meds before substantial physical decline. Prednisone and deflazacort, an oxazolone derivative of prednisone, is used to treat DMD. Exondys 51 is an exon-skipping drug that has shown to increase dystrophin in patients with a mutation of the dystrophin gene, amenable to exon 51 skipping, and also Viltespo, an exon-skipping drug that targets a section of DNA called exon 53. If a patient is having respiratory difficulties, non-invasive devices for ventilation may be necessary. These devices may consist of nasal cannulas or masks, or a BiPAP or CPAP machine overnight. If continuous ventilation is needed, a tracheostomy may be indicated for 24-hour ventilation assistance. Before we close this evening, my hope is that you've learned that muscular dystrophy is a rare genetic condition of skeletal muscles that has over 30 types of this condition. The most common types of muscular dystrophy include Duchenne and Becker. The most common symptoms are muscle weakness, enlarged calf muscles, difficulty walking or running, abnormal gait, difficulty swallowing, heart complications, learning disabilities, joint stiffness, muscle pain, scoliosis, and breathing issues. Muscular dystrophy is diagnosed by patient and family medical history, physical exam, CK levels, genetic testing, muscle biopsy, and EMG. The last topic I want you to remember is that there isn't a cure for muscular dystrophy, but there is treatment for management of symptoms and slowing the progression of the system. Treatments include physical and occupational therapy, the use of braces and wheelchairs, corticosteroids, exon skipping drugs, glucosteroids, and ACE inhibitors, ARBs, and beta blockers. Thank you for your time.